When disaster strikes, geography and infrastructure determine who survives. Canada possesses 5 critical advantages most Americans do not realize exist. These are not theoretical, they are measurable survival differences. A Canadian emergency room never asks for proof of insurance before care begins. Instead, a health card is scanned at intake. No questions about payment, no forms, no delay. In the first minutes after arrival, the triage nurse applies the Canadian triage and acuity scale, assessing each patient for urgency. The entire system is designed to move people directly toward treatment based on medical need, not financial status. In a crisis, whether a mass casualty event or a citywide blackout, this structure remains unchanged. Every province follows the same protocol, eligibility is confirmed instantly, and all emergency care is covered. By contrast, most American hospitals require insurance verification during intake. Even with federal laws mandating emergency stabilization, private facilities often pause for a 10 to 20 minute insurance check if the situation is not immediately life-threatening. Administrative staff enter policy numbers, call payers, and sometimes request payment up front. For uninsured or underinsured patients, this can mean extra paperwork, confusion, or outright denial of non-emergency services. In mass casualty scenarios, these steps multiply, sometimes delaying care for dozens at a time. The Canadian workflow eliminates this barrier. There is no billing team at the bedside, no risk of being turned away over coverage status. Triage nurses focus on symptoms and urgency, not cost. After discharge, the province handles all billing in the background, with denial rates near zero for emergencies. In the US, even after care is delivered, patients face claims disputes and potential denials, problems that never enter the Canadian intake process. This difference in first contact with the healthcare system is not just a matter of convenience, it is a structural advantage that can mean faster access to life-saving treatment when seconds count. Stockpiling medication is a basic survival tactic, but the cost difference between Canada and the United States turns this strategy into a structural advantage north of the border. In Canada, a 6-month supply of insulin typically costs between $150 and $300 Canadian dollars out of pocket, thanks to federal price controls and provincial drug plans. For many Americans, the same stockpile can exceed $1,500 to $3,000 US, especially for those without comprehensive insurance. The Patented Medicine Prices Review Board in Canada sets strict upper limits on prescription drug prices, and most provinces offer additional subsidies. This enables Canadians to quietly build up reserves of life-sustaining medications, insulin, beta blockers, and statins, without facing financial ruin. In the United States, no such national price cap exists. Pharmaceutical companies negotiate with thousands of private insurers, leading to wide price swings and high out-of-pocket costs for the uninsured and underinsured. The result for many Americans is that even a modest 6-month supply of insulin or heart medication can trigger debt or bankruptcy. Health economists point to the numbers. Over 500,000 Americans file for medical bankruptcy each year, while in Canada the rate is near zero. For preppers and those managing chronic illness, the ability to afford a personal medication stockpile is not just a matter of comfort. And in a disaster, when supply chains break or pharmacies close, it can be the difference between survival and catastrophe. A simple table tells the story. Insulin in Ontario costs between $150 and $300 Canadian dollars for 6 months. In Texas, the same supply can cost $1,500 to $3,000 US. This gap is not a loophole or a temporary market glitch. It is the result of deliberate policy choices. In Canada, affordable medication stockpiles are a built-in layer of resilience, quietly protecting millions when the system is under stress. Winnipeg, Manitoba faces minus 40 degrees Celsius as a matter of routine. In February, the city's electric grid hums steadily while temperatures plunge beyond what most Americans will ever experience. Power lines are built higher off the ground to avoid drifting snow. Water mains run deep beneath the frost line, encased in insulation. Every home and hospital is equipped for days or even weeks of hard freeze. Block heaters are standard and backup generators sit ready in basements and public buildings. Utility crews rehearse rapid response drills for ice storms and blizzards, not as rare emergencies but as regular features of winter life. Contrast this with Texas in February 2021. 2 inches of snow and temperatures dipping to -10 degrees Celsius triggered a statewide blackout. The Electric Reliability Council of Texas, known as ERCOT, watched as natural gas plants froze and 4.5 million homes lost power. Pipes burst in thousands of buildings. At least 246 deaths were linked to the cold, many from hypothermia or carbon monoxide poisoning as people improvised heat. Federal regulators later revealed that ERCOT had ignored winterization warnings issued a decade earlier. In Manitoba that same week, the temperature dropped to -42 degrees Celsius. The grid held. No province-wide outages, no collapse of essential services. Schools closed only when wind chills threatened exposed skin within minutes, but critical infrastructure remained online. A prairie utility operator describes these cold snaps as routine stress tests. Equipment is built for extremes, not averages. Emergency shelters are mapped out in advance, and residents expect to check on neighbours during outages. In Canada's coldest cities, survival is woven into the design of every building and the habits of every household. The difference is not just in the weather, but in the systems and culture that expect it, turning what would be a disaster in much of the US into a manageable inconvenience north of the border. Canada's population density, just 4 people per square kilometre, stands in stark contrast to the United States, where 36 people share the same space. For emergency managers, this ratio quietly determines how long essentials last when supply chains are disrupted. In a city like Toronto, with 2.9 million residents, shelves can be restocked before panic buying empties every aisle. Compare that to American cities where populations of 3 million are common, but the surrounding density means every delivery is consumed almost instantly during a crisis. Resource competition is a numbers game. In rural Saskatchewan, a grocery store manager describes how, during the first 72 hours of the COVID-19 lockdowns, only 20 to 30% of inventory disappeared. Supplies stretched further because fewer people were drawing from the same stockpile. Meanwhile, in rural Illinois, where the density is 9 times higher, managers reported 70 to 90% depletion, with some stores stripped bare within days. The difference is not just in how quickly food vanishes, but in the pressure that builds as neighbours compete for the last essentials on the shelf. Lower density means more than just slower depletion. It offers a buffer, buying time for new shipments or for residents to adapt. Emergency planners in Canadian municipalities routinely factor this into their models, calculating how long water, fuel and food will last before outside help arrives. The numbers are clear. With fewer people per square kilometre, Canadians face less direct competition for every loaf of bread, every litre of water, every gallon of gasoline. In a prolonged crisis, that margin can decide who waits and who goes without. Canada holds 20% of the world's fresh water, an asset that shapes survival odds in ways few Americans consider. While US states battle over shrinking reservoirs, with California's storage dipping to 25% capacity and Colorado River allocations cut by 1/5 in 2023, Canadian provinces quietly manage vast lakes and rivers with no major internal lawsuits. In the American Southwest, water has become a legal battleground. Arizona and California have filed suits over more than 1 million acre-feet, and federal agencies predict that disputes will escalate further by 2030. In contrast, Canada's Council of Ministers resolves water allocation through negotiation, not litigation, and the last significant interprovincial conflict ended decades ago. For Canadians, abundant freshwater acts as a strategic buffer, ensuring that even in drought or disaster, access to drinking water is rarely threatened. Where Americans face rationing and legal fights, Canadians rely on a safety net built into their geography and policy. More than 1,000 Canadian communities exist beyond the reach of any road. In places like Pikangikum First Nation in northern Ontario, daily life depends on float planes, snowmobiles and diesel generators. When the grid failed in 2022, residents kept homes heated and water running for 10 days using backup systems they maintain year-round. Hunting, fishing and foraging are not emergency measures, they are routine, passed down through generations and woven into the school curriculum. Over 2 million Canadians hold active hunting licenses, and in many provinces, game meat supplements grocery store supplies every winter. These skills are not fringe or survivalist, they are standard practice. In the United States, off-grid living is rare outside of Alaska, and hunting is often viewed as a subculture, sometimes even stigmatized as extremist. American rural communities, even in remote areas, depend on highways and regular deliveries. When roads close or power fails, resupply can grind to a halt. In Canada's fly-in settlements, resilience is collective. The community shares fuel, rotates generator upkeep and organises food harvests as a matter of course. These settlements offer a living blueprint for survival, demonstrating that when systems break down, Canadian society already has tested models for continuity that most Americans have never practiced. Today, Canadians face crisis with systems built for survival, including universal healthcare, lower drug costs, cold-hardened infrastructure, and access to vast fresh water. Americans confront higher stakes with insurance hurdles, resource scarcity, and brittle networks. In the next disaster, these structural differences decide odds, not just for nations, but for lives. What do you think?